Good morning and welcome to the Terry Talks Nutrition Educational Webinar Series. Today's topic, Nature's Anxiety Miracle, and our very special guest is Dr. Gaetano Morello. We'll be getting started at 10 a.m. Central Time, which is about 1 or 2 minutes from now. Thank you so much for your patience, and we'll be getting started shortly. Good morning, and thank you so much for joining us today for a Terry Talks Nutrition Educational Webinar. Today's topic is Nature's Anxiety Miracle, and our very special guest presenter is Dr. Gaetano Morello. Before we get started, I want to do a quick sound check. So, Dr. Morello, I just want to make sure.
Cheryl, can you hear me?
I can hear you. Can you hear me?
Is it clear? Because I have you on speaker, so I want to make sure it's...
It's very clear for me. If we get any notices in the chat box that you are, unclear, I can always break in and ask that you move to handheld.
Great.
All right. Well, thank you, folks, for joining us today. Let's get started with our Terry Talks Nutrition webinar. For those of you who are having any difficulty with listening to the audio portion of this webinar via your computer, please know that you can also call in via the telephone number 877-668-4493. Enter the access code that appears at the bottom of the slide, and you'll be immediately connected to the audio portion of today's webinar via telephone. If you have any other technical support issues, please call Technical Services at 866-569-3239. I also wanted to show how we are best able to ask questions during this webinar. And some of you may be hearing an annoying little tweet noise or a little beep noise. I want you to know that we are working on getting rid of that noise. We are in connection with Technical Services, and we're going to see how that goes. So here's how you ask some questions. In the lower right-hand corner of your screen, you'll have both a chat box and a Q&A box. If you don't see either one of them, please note that you have icons at the top of your screen that open these boxes. The Q&A box is one-way communication. You type your message in the small box at the bottom of the page, and then hit send, and your messages will appear here. And then when we get to the end of today's webinar, we'll answer them in the order in which they are received. If you have a chat message, that's two-way communication. If you use the chat box, that's a good way to ask us a question behind the scenes. For example, if you're having trouble with the slides advancing, or if you have some technical issue and you want to ask us a question, just do the same procedure. Type in the small white bottom at the bottom of the page, at the bottom of the chat box. Select send. You can select to send just to the host, Lexi Locke, or you can send to the entire group. But for chats, you probably just want to send it privately, and then your message will be communicated to us. If you have asked us for some technical assistance or you have a quick behind-the-scenes question and you've used the chat box, please monitor the chat box because that is where your answer will appear. So it's my very great pleasure to introduce to you someone that I find to be one of the most fascinating speakers I've ever listened to, and that's Dr. Gaetano Morello. He is a licensed naturopathic physician. He practices in West Vancouver, Canada. He is a clinician at the Complex Chronic Disease Program at the British Columbia Women's Hospital in Vancouver. and he is the first naturopathic physician to hold such a position at a major North American hospital. So he truly is a groundbreaking integrative medicine expert. Since 1991, he's been training and educating physicians, pharmacists, and all kinds of other health modalities on how to use natural medicines to achieve optimal health outcomes. He is, if he's not busy enough with his clinical practice, he is also a contributing author to Alternative Medicine, a textbook of natural medicine, and the author of Whole Body Cleansing and Cleanse and Inside Out Approach. He's a member of the Quality Assurance Committee for the College of Naturopathic Physicians of British Columbia, and it is with great pleasure that I introduce to you today Dr. Gaetano Morello. Welcome, Dr. Morello.
Oh, thank you, Cheryl. You're too kind. And I enjoy hearing you speak as well. I've had lots of fun times listening to Cheryl describe different naturopathic and alternative modalities in great detail and with lots of fun. So I enjoy her speaking abilities as well. So thank you, Cheryl, for that. And today we're going to be talking about, I always enjoy speaking about ingredients that I use, and very seldom do I talk about something that I haven't used in clinical practice. We can go through studies and look at studies, but, the proof is always in the pudding, and the effects that we get with products is where I get excited, and when I see them on a clinical level, and I see outcomes over and over again. So I'm always interested in outcomes because that's what my patients want. That's what I achieve to do. We're going to talk about a really important topic today, the topic of anxiety. And as Cheryl pointed out, I work at BC Women's Hospital where we treat complex diseases. So these are conditions such as fibromyalgia, chronic fatigue syndrome, myalgic encephalomyelitis, Lyme disease, multiple sclerosis, these very difficult to treat conditions. And one of the things that most of these patients will have is they will have a high level of anxiety and stress, and usually on all sorts of medications. And so I've had the opportunity to introduce a product like AngioCalm to these patients. So this is what we're going to be talking about today, this very unique extract that to me is the fastest acting natural ingredient that I've seen in the industry. So I'm pretty excited to begin a presentation on it so we can understand how to use it and what the modalities of action actually are, because that's an important component in all this. And also to understand that, and I share this with lots of physicians, because they always tell me, Dr. Morello, you said to give this product to my patients, and it never worked. And I said, well, which product did you use? Well, you said to prescribe curcumin. Well, which curcumin did you use? What is very different from pharmacological medicine as opposed to alternative medicine, herbal medicines, is that when we prescribe a tetracycline, for example, that tetracycline, no matter where that patient goes to get it, which pharmacy, it's always tetracycline. But when you prescribe natural ingredients, say we prescribe curcumin, well, there's 30, 40, 15 different varieties of curcumin, and they don't all work the same. So it's really important to understand brands. So one of my big topics right now in educating physicians is to understand brands, so we are able to prescribe the right brand, because they're all different. And so we need to get the one that has the clinical studies, that has the outcomes that we need. So let's start by talking about this natural miracle to anxiety, because it truly is. To start, I think most of us know or have felt at one time or other anxiety, but the definition is, and this is straight out, a lot of this information is out of my booklet that's about to get printed very soon, and so you'll just really ask this group to send you copies when it's ready. But the definition is, anxiety is often defined as an unpleasant emotional state ranging from mild unease to intense fear. It includes both the emotional and physical feelings we might go through when we are concerned or nervous about something. And I think most of us at one time or other have felt this anxiety. And anxiety is really different from fear, because fear usually responds to an actual event. Anxiety doesn't. It could be, worrying about the clouds outside, and all of a sudden you've got this intense fear of clouds. I mean, so it really doesn't have an actual event. It's an interpretation. It's an interpretation in our minds which really sticks to an area called the amygdala, which we'll talk about a little bit later on. And all of a sudden, every time you see a cloud, you're going to have this emotional state which can create lots of other problems. Now, there is a difference between anxiety and stress. Stress is a response to a threat in a situation, while anxiety is the reaction to the stress or perceived stress. And so, when patients come in, and this is a really important component of all this. One of the things that I find with these complex disease patients is that there was a stressful event sometime in their lives. There was an anxious event, and they still have that anxiety is still present. And so one of the common causes of so many of these conditions, one of the common contributing factors is really stress and anxiety. And so a lot of my patients say, well, how does that happen? And I know that a lot of us say, well, my friend got a heart attack because he or she was under a tremendous amount of stress. My friend developed cancer because he or she was under tremendous amounts of stress. Well, how does stress and anxiety create these issues? And so I think it's important to understand this particular aspect. And the reason why that happens is really something we call the sympathetic response. And what is the sympathetic response? The sympathetic response is this. When there's a reaction to stress, or anxiety, this is one of the responses that the brain signals out. And the best example that I can give, and I always give, is the zebra and the lion. So when the zebra meets the lion in the jungle, the zebra is going to what? It's going to be full of anxiety and stress. And the zebra has two choices. Either fights the lion or runs away. That's why it's called the fight or flight response. And that particular moment, besides all the hormones going crazy, one of the things that occurs is the sympathetic response kicks in. And that sympathetic response is going to send signals to the gastrointestinal tract to shut blood flow to the gut. The gut holds about 1/3 of your entire body's blood supply. And it pulls that blood to the peripheral tissues, to the zebra's limbs, so the zebra can run faster. During that period of time, guess what? The gut is not going to be getting the supply of blood that it needs. It's not going to get the oxygenation it needs. Therefore, the gut is going to be compromised. Now, one of the most fascinating things about the gut is this, that what separates everything in your gut, all 100 trillion bacteria, whatever that count is, all the bacterial particles, those lipopolysaccharides, those bacterial cell walls, those undigested food particles, what separates all that from the blood is actually one cell. It's really the paradox of the human body, because that one cell lining has to be strong enough to block any of those compounds from getting inside the blood, at the same time has to be permeable enough to allow nutrients to get inside the blood. When that sympathetic response kicks in, guess what's going to happen? We're going to get increased gut permeability, where the integrity of that lining is going to be broken down, and we're going to get this translocation of compounds. And these compounds will cause reactivity within the blood, creating all sorts of issues. As an example, we know that antibodies will be created to these translocating compounds. We know that certain compounds from these bacterial cell walls can get into cells and impact the mitochondria and their ability to produce energy. So all these things occur because of that anxiety and that stress. Now, in the zebra's case, the zebra runs for 5-10 minutes, beats the lion, and everything's back to normal. So guess what? That stress, that anxiety saved the zebra's life. The gut was compromised for a short period of time, and everything back to normal. But that doesn't happen in our lives. We have stress and anxiety not for 5 minutes, sometimes for an hour, sometimes for a day, sometimes for a week, sometimes for a lifetime. And this creates a lot of issues. So dealing with anxiety and stress becomes an important component of health. So anxiety sufferers, usually focus on minor issues, and this is the problem. So the problem is that the worry is disproportional to reality. Some of the components of anxiety are worrying about, meeting a deadline, family events, worrying about, an exam. And then also, when you have a traumatic event, that traumatic event can be stored in the amygdala, and all of a sudden, every time you see anything close to that, those emotions come back. And this is kind of what PTSD is all about. And so we'll talk about that a little bit later on, but there is so much in anxiety that creates and stimulates that sympathetic response, and these are little things. I remember my sister had anxiety over seeing birds, and so we had to work on that to try to get her over that vision of a bird having this anxiety, which would last days on and out. And I'm sure all of you have friends or even experienced some form of anxieties yourselves. You know, when the alarm, when you're on the road and you hear where, when an ambulance or a police officer is behind you, you know, you have that little bit of anxiety because that is a stored memory. That's important to you because you know, that is an actual action which needs a reaction from you. In other words, move over because there's an ambulance trying to go through. So that kind of is a protective system. You can see how little triggers can create this anxiety and these sympathetic responses. So, you know, if the anxiety is short-lived, it's fine, but it's when it goes on for a long period of time. This is when it becomes chronic and creates problems. So how do we manage, you know, the key is how do we manage this stress and anxiety to reduce its sympathetic response that is creating all sorts of long-term conditions? Because, you know, what's interesting, and let me go back to it again, what's interesting is that my patients, and I have thousands of them, I have a 2-year wait list. That's how busy we are, and that's how many people are suffering from these conditions. And what's interesting is this, and I want to share this with you because this is so fascinating. When I ask what these patients have done, remember, these patients have been suffering from these conditions for 10, 15, 20 years. These patients have seen every physician possible. They've taken all sorts of drugs. They're on all sorts of supplements. And one of the interesting components of my question is this: have you done anything that's made you better? And usually, there's an answer that a percentage of them tell me that when they do dynamic neural reprogramming, which is trying to downregulate that sympathetic response through coping strategies, et cetera, their symptoms get better. And then I said, they do? They said, yes, they do. And so then I asked the question, why don't you continue doing it? It's too much work. So do you have a pill that I can take that can help me downregulate this response? And so that tells you that, you know, this sympathetic response is playing an enormous role in this. And I can tell you that every time I ask my patients this other question, and I tell them, I'm going to ask you a question, I already know the answer. And in medicine, we're not supposed to assume anything, but I assume this every single time, and that is that when you have more stress and anxiety in your life, all your symptoms get worse. And it's always, the answer is always yes to that question. And the symptoms of these conditions are what? They're fatigue, they're cognitive dysfunction, they're post-exertion malaise, they're gastrointestinal issues, there's sleep issues. All sorts of issues are created by this sympathetic response. So the way that we manage stress and anxiety, there is management programs out there. There's developing positive coping strategy. Getting a good night's sleep is so important, and so many people can't sleep. So there's a lot of really great natural products for sleep that actually have good outcomes. So we need to look at those because a lot of people are taking all sorts of medications. Stabilizing blood sugar levels are important because during stress responses, anxiety responses, your blood sugar often drops. So keeping that steady level of blood sugar is important. Nourishing your body and your brain with good nutrition, managing your life. All these things are coping strategies that we try to employ with these patients. Now, there's a number of different anxiety disorders. Some of them get complicated. There's generalized anxiety, there's panic disorder, social anxiety, specific types of phobias, OCD, and there's also PTSD. I'm going to just briefly go through them in the next slide. This is straight out of my book. Generalized anxiety. So we'll just go through these quickly. Generalized anxiety disorder is really the one that we're most that we see quite a bit of. I think all of you have seen this from a friend or yourselves suffered through this at one time or other. And this is really where you have an excessive and unrealistic worry and tension about everyday things. These symptoms occur even if there is little to nothing to excite the anxiety. For example, worrying about the telephone bill, worrying about an exam, but keep worrying about it, almost into a chronic state. Panic disorders and panic attacks, and these are actually quite scary. These are individuals with conditions where they experience this feeling of terror. Out of nowhere, all of a sudden, their hearts are racing, their blood pressure is going up, they're sweating, sometimes they get into seizures, and they feel like they're having heart attacks. So often they go to the emergency ward, and then they check out the cardiovascular system, and everything is fine. It was a panic disorder, and these disorders can occur sporadically. Social anxiety disorder, over 50 million Americans suffer from this. And this is where people feel worrying and they're self-conscious about daily social situations. They basically worry about people judging them, that they're not going to be accepted. And so these are social anxiety disorders, which cause a lot of problems, in developing, developing yourself and being able to do things, going out in public, enjoying what life has to offer, what the world has to offer. This is 50 million Americans suffer from this. Then there's also specific phobias, fears of like bridges and climbing ladders and flying. And interestingly, all these disorders I've treated with the special extract we're going to be talking about today. I remember recently having a patient who had real problems getting on planes, so because of anxiety, and I gave her the extract, and guess what? She was flying with no problem. So amazing outcomes. And then obviously there's the more everybody's heard about obsessive compulsive disorder. This is where people will wash their hands, 500 times a day, and they have all these compulsions and these ritualistic behaviors and routines that they keep going over and over and over again, which obviously is going to interfere with what you're doing in the day. If you're washing your hands 500 times, it's going to interfere with your daily activities. And then there's, something that's, is upon us, and that's post-traumatic stress disorders. And these are individuals who have a past history of experiencing or witnessing something they found very traumatic. And these people will have flashbacks or nightmares about their trauma, and they feel like they're reliving the experience. This occurs, and the amygdala is the real center of this. So all these different types of anxiety disorders, we can help by utilizing specific natural compounds, which we'll talk about, and doing some of the strategies that we talked about earlier. The main pharmaceuticals to treat these things are all the different types of tranquilizers: Xanax, clonazepam, lorazepam, Ativan. This is probably the most popular. And physicians are very they try to hold back from giving these compounds, believe it or not. We are very weary at the hospital of giving these drugs. Why? Because they're addictive, and it's hard to get people off of them. We're having lots of problems right now with opiates, these painkillers, because it messes up biochemistry in the body, and this is the problem. And so if we can utilize an alternative that actually has an impact, we're going to be utilizing it. So one of the things I've been really promoting heavily at the hospital is this extract we're going to be talking about today, because of the outcomes that it gives us and because we know the mechanism of action. So believe it or not, we are trying to get away, the mainstream is trying to get away from these medications, because we're finding that these medications are causing a lot of problems. So really there's an abundant new area of research. It's called the endocannabinoid system, and it's a system I've been studying for the last 3 years because I find it fascinating. The endocannabinoid system is the largest receptor system in the body. the largest receptor system. And, and medicine is really starting to focus on it because this endocannabinoid system has these receptors that have all sorts of different impacts on health. For example, there's both CB1 and CB2 receptors. CB1 receptors are found in the central nervous system and some of the periphery, so some of the peripheral nervous system as well. And when we activate these CB1 receptors, they have all sorts of impacts on not only anxiety and stress, they have impacts on pain as well. So when we activate CB1 receptors in the peripheral nervous system, we can downregulate pain. When we activate CB1 receptors in the central nervous system in the brain, we can calm things down, which is pretty fascinating. And so we're seeing more and more of this, of these effects. CB2 receptors are located on white blood cells. When we activate CB2 receptors, we get an immune-stimulating effect, so we can bolster the immune system. Now, the endocannabinoid system is made up of really three different aspects. The first one is what I just talked about, and this is both CB1 and CB2 receptors located throughout the body. The largest receptor system in the body. Then there's the endogenous cannabinoids, which is the second part. The endogenous cannabinoids, like cannabis, yes, these are compounds made by the body. Anandamide is one, and 2-AG is the other. These are all econocides that bind to cannabinoid receptors, imparting specific cellular action. So, part one, CB1 and CB2 receptors located throughout the body. Part two, we have endogenous cannabinoids. Anandamide is the most popular. And when anandamide is made by the body, and for example, and it sticks to the amygdala, guess what happens? You're very calm. The third part of the endocannabinoid system is the enzymes that synthesize and degrade the endocannabinoid, such as fatty acid amide hydrolase. We call it FAAH for short. So listen to this. This is really interesting. Matthew Hill at the University of Calgary has actually done a lot of research in this, and this is what he's found. He has found that when patients have SNPs in FAAH, in other words, when the DNA does not produce enough FAAH, this enzyme, this part 3, those patients have very little anxiety and stress. Let me go through that to explain it, because it's really important. It's at the cusp of some of the stuff we're talking about. So when the body produces a lot of anandamide, the anandamide binds to CB1 receptors in the amygdala. Guess what? You feel bliss. FAAH breaks down that anandamide, so you don't feel so blissy all the time. When patients don't have enough FAAH where they have, because you can't break down anandamide, guess what? They're always happy. Which is pretty interesting observation, which gives us a little bit more insight as to why some people are so calm and others have so much anxiety. And I know you all know those types of people, because I do. I know my mother, she's always worried about the telephone bill. Gaetano, the telephone bill, it's due in another 3 weeks. It's $15. Mom, it's okay. It's not a big deal. So we have these individuals that worry about these little things, and that's really, it's in part due to the actions of the amygdala, and we can actually have an impact on it with activating these CB1 receptors, which is really an exciting field that is full of new research right now. So I'm very excited. Again, here's a picture of the brain, and here is the, let me see if I can play with this, because I've been wanting to play with this thing for a while here, but I haven't got, let me see if I can do the arrow. There is the amygdala right there. There's two of these round little, they look like little balls, little marbles, and this is where the area of anxiety and emotions and fear all are really around. This is where you get the panics. And so if we can activate the amygdala through by activating those CB1 receptors through endogenous cannabinoids, we can have an effect on anxiety. So here's an interesting discovery. So now we're going to talk about the product. What's happened is this. There's lots of research done on the endocannabinoid system with CB2 receptors, because when you activate CB2 receptors, what happens? Well, your immune system goes up. So stimulating CB2 receptors on white blood cells improves immune function. So scientists discovered that some of the compounds found in nature not only impacted CB2 receptors, interestingly enough, they found that they also activated CB1 receptors. And so what products do we know that impact the immune system? Well, we know that Echinacea impacts the immune system. And we know that Echinacea impacts the immune system, has an impact on, the duration of colds and flus. And so in that research, when they were looking at the endocannabinoid system and what Echinacea was doing to the upregulation of the immune system, they also found, these Hungarian researchers found, that certain compounds in the Echinacea affected not only CB2 receptors, but also CB1 receptors. So here's a product that, wait a minute, has an effect on the immune system. It can have an effect on anxiety. I mean, I know I would have never guessed that, but they figured that out. And they were able to isolate these specific compounds within the Echinacea that imparted this activity. Now, the extract of Echinacea utilized in this particular product is very, very pure. It's free of heavy metals, pesticides, and microorganisms. So we're looking at a very pure compound, because all these compounds, you want to make sure that when they're isolated in the purest form. And so, so how is this Echinacea going to work? Well, it's going to work on the endocannabinoid system, the system we've been talking about. And if you look on the right side here, let me get this fun pen going here again. If you look at this fun side, here is an andamide, what an andamide looks like right here. You see this long structure, and look at the alkamides in Echinacea. The alkamides are the compounds that impart this activity. You see how similar they are? So when they're similar like this, they have the ability to bind to the same type of receptors. And so this is what's been discovered with alkamides, and Echinacea is rich in alkamides that actually impart this activity on CB1 receptors in the amygdala, which is really a fascinating new area. I think this is so exciting, this product. I really get excited about it. And do you know why I get excited about it? Not because I can talk about the mechanism of action, because I can see it working. And so the most important thing is, does it work? Does it give me outcomes? And darn right does it give me outcomes. So when we look at the alkamides in Echinacea, what they're actually doing, well, they're affecting CB1 receptors. They have a very interesting effect on CB1 receptors in that the calmness is not the same as the Ativan calmness. It's a much better calmness. It doesn't knock you out. It just takes off that edge. And also there's also mild inhibition of the Fa enzyme. Remember the enzyme that breaks down the anandamide? Well, it has an impact on Fa as well. So it also has strong effects on TRP receptors, which also play a role in anxiety. So here we see a natural ingredient that has a product, an alkamide, that's very similar to a natural ingredient produced in the body called anandamide that impacts these receptors in the amygdala that can really cause a reduction in anxiety. So the research is there, and so let me just briefly go through some of the research when I get this thing to move. Cheryl, can you move it? It's not going to the next slide. Okay, I don't need the next slide. It's okay. If anybody can help with the movement of the slide, I'm on Echinacea research, but I can't get to the next slide for some reason. My cursor's stuck. But here we go. Thank you. Okay, here's some clinical studies. So men and women with increased levels of anxiety received 20 milligrams of the special. They noticed effects after 1 day and significant reduction in anxiety by day 2. The anti-anxiety effect lasted 14 days post-treatment. No adverse effects. Efficacy was similar to results reported with benzodiazepine drugs. This is what I'm seeing. So what I'm seeing is this. I'm not giving 1 tablet. Give 2 tablets. And when I give 2 tablets, I have an anxiety relief. I see an outcome within 30 minutes, sometimes 15 minutes. fascinating. So I see the effect much, much quicker than taking one tablet. So always give 2 tablets. I find much better results with 2 tablets. And the outcome, within an hour. There's patients that have come into the hospital where I've given them 2 tablets, and I told them to go for a walk, and they come back, and their anxiety is reduced. So it works very, very quickly. It's something I always give a PRN, take as needed, because it's that fast-acting. It's quite remarkable. So, again, what does that tell me? That tells me that this is crossing the blood-brain barrier very, very quickly, extremely quickly, because how can you have an outcome in 15 minutes without that impact? So it's quite impactful. And again, we have research, and here's another one. We've got lots of research out there, but again, the important thing is, does it work in a clinical setting? As a physician, when I give it, does it work? Are my patients getting results with it? That's what I want to hear. I can read all about the research, which is important because this is our foundation, but does it work in a clinical setting? And also, here's where it says, if anxiety prevents you from sleeping, I would give 40 milligrams before bedtime, and it does help quiet the mind. A lot of people get great results with sleep with this as well. And yes, there's no drowsiness or mental fogginess in the morning. Very, very few. I've had very few negative outcomes with this product. And I'm going to share with you the negative outcome I've had. So I've given it to about 800 patients, and there was one outcome where the patient actually got more anxiety when they took it. So this is 1 out of 800. So there is really no consequential effects on this. It's completely safe. I mean, I've given it to kids as well. So if somebody's going to ask me a question about kids, yes, but I've reduced the dose. I don't give 2, I give 1 to kids. And it has a real impact on them as well. So I've given them as low as 12 years of age. So it works on kids as well, works on teenagers, and it is something that I think everybody should be using. I mean, I'm going to say this is a groundbreaking product. Honestly, I mean, if you would have told me that one day I'd be using a special extract of echinacea to get an anti-anxiety effect, I would have said, what? Are you kidding me? And it really, really is remarkable. Now, again, not all these echinaceas are not going to work this way. You have to have a specific type of echinacea picked at a specific time, specific species with the high levels of alkamides. So these scientists in Hungary did all sorts of research to try to find this specific type of echinacea, and they have a specialized extraction process where they process it and they get these alkamides out of them that are actually imparting this anti-anxiety effect. So it's a really remarkable ingredient. So and anybody has any type of anxiety, this is the product to use and use it. And anytime you have any type of stress, you can use this product as well. And again, you will get the outcomes very, very quickly, and that's what's important here. And you'll be able to see it right away. So I really encourage you to utilize this remarkable, miracle of nature. Here's nature. It just gives us so many incredible opportunities, and this is a great opportunity for you to utilize. And I can safely tell you that this is a very, very effective product, and I'm telling you that because I've used it on so many patients. Okay, that ends my presentation. Are there questions? Cheryl, can you take over?
You bet. Thank you so much. That was so informative. Every time I listen to you speak, I learn something new. All right. So we do have some questions. One is, in your experience, can pregnant women take this form of echinacea?
Yeah, and that's a question that, I get asked often. So to give you an example, so I'll use my own family as the example, okay? So my wife has had a problem sleeping, and our third child is a beautiful 20-month-old Capri, and during her pregnancy, she was having a lot of problems sleeping, and we didn't want to take any medications, so I was giving her the Anzio, this product for her, so it was safe. Now, again, as a physician, we always want to be careful with these situations, but I see no issues with this product in pregnancy. So my wife took it pretty consistently during her pregnancy.
All right. We have had several folks ask us where they can get this product. We try very hard to try to keep this third-party information and not an infomercial. So we try to provide the scientific side of natural medicine use. But if you are interested, we will be sending out an email that will give you more information on how to find this product if you think it's something that's useful for you or if you want to talk to your doctor about it. We also have another question here about should you take 2 at once or split up the dose?
You know, in my experience, and I would say that I would have extensive experience with this ingredient, I find 2 are much more effective. I do tend to give 1 to children when they have certain phobias or anxieties, but I find 2 very, very effective. Some people, you know, will have an impact with 1, and so, but, you know, I always like for patients to feel the effects, and 2 is what I get. I don't split it. So, and I do a PRN, which is when needed. So, you know, and it does take that edge off. You will feel it, so 2 is what I regularly recommend. I seldom recommend 1 unless it's children.
Yeah, awesome. And here's a person that wants to know that they read some of the research and the dosing can vary a little bit. So what's the top level of dosing that you would use?
Cheryl, sorry, the top level of dosing?
Like the top. I mean, how high can you go? If you're not getting results at 2 a day, can you go to 4 a day, 6 a day?
You could try that now. And, you know, in most cases, you know, you'll see results with 2. Now, if you don't see results with 2, you can go to 3. I mean, I see no consequential negative effects of going to three tablets because, you know, it doesn't have the same effect on those CB1 receptors as an Ativan, so or a Valium. It's different. So you can go higher dose. I've given how high have I gone? I think I've gone to 4 or 5 in some patients. Not very often, though. I haven't done that very often.
And another question, can you crush the tablets?
You can crush them if you want to, but I wouldn't. And the reason is because alkalides are really bitter. They're extremely bitter. So, but you could if you wanted to, but they're very, very bitter. So, so having said that, yeah. So you can crush if you want to, but you're gonna have to mix it with something because you don't want that bite in your mouth and in your throat. So. And
these are very small. These are very small tablets. So.
They're very, very small, tiny. They're tiny, tiny tablets.
So it shouldn't be too.
They're nothing. They don't look anything like a multivitamin. This is very, 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 very small.
All right. Here's another question wanting to know if you have an autoimmune disease, can you still use this echinacea derivative?
Yeah. Yeah. No problems.
Yeah, because it doesn't stimulate the immune system, correct?
That's right. It's stimulating those CB1 receptors, right? This is not. So this is this prime the drive that this is not the immune stimulating part. This is why you can't just go get any echinacea on the market because it's not going to work. Because those have the immune stimulating properties. They don't have the anti-anxiety properties.
Awesome. Excellent. Here's another question wanting to know if it's okay to use if you are on an antidepressant medication, the SSRIs.
Yep, I've given it to patients. Most of my patients are on antidepressants, so all the ones that I have, so I do give it to them. The mechanisms of action are different. So most of the antidepressants are like you just said, they're serotonin uptake inhibitors. This works on a whole different. This works on the endocannabinoid system, which is a system that the only thing that's worked in the past that we're familiar with is the cannabis world, and so this is a whole new world of medicine that's opening up right now. So it works on a completely different system.
All right. So 2 questions just popped up. One has to do with they have a dog that has horrible anxiety with thunderstorms and loud noises. Is this okay to use in dogs?
Yeah, I think it absolutely is because I think some of the original research was actually done on animals, and a lot of research is done on animals to begin with. So I can't see I'm always talking from a experiential point of view. So, you know, I have not given it to animals. I've given it to patients. That's where my experience lies. But, you know, as a clinician, as a scientist, I cannot see it having any negative effects on animals. So I think it would work on animals as well.
Excellent.
And I think there are case reports where it has worked. And remember, the clinical research, the early clinical research was done on animals. So I would probably start with one tablet. That's what I would do.
Also, here's another question that they're interested in the fact that it's the endocannabinoid system, and that an herb we know that stimulates strongly the endocannabinoid system is cannabis, marijuana.
Right.
And so now they're saying there's no way that this would cause a positive drug test, though.
No. It's not going to cause. Yeah, the issue with cannabis is that it has psychotropic effects, and you know, you have those levels of THC. This is not going to cause a positive drug test. No.
So just because it's flipping the same switches does not mean that the
herbs
themselves are chemically related.
It's a different compound. Right. It's like, you know, you have endogenous anandamide. You know, you're not going to get. It's not going to test positive. They're not measuring alkamides.
Okay. All right.
Well, this is just turning on a switch. Right. Correct.
Wonderful. All right. Just double checking to make sure we don't have any. I think we got through all of the questions. Just double checking. Yep. It looks like we did. Dr. Morello, it's always a pleasure to have you with us. I hope you'll join us again in the future. You always have such incredible information to share on the best use of natural medicine. So thank you. Thank you so much.
Well, thank you, Cheryl, and take care. Great. Bye-bye.
Bye-bye. Folks, our next event is going to be on Thursday, December 8th, presented by Terry Lemerond. That'll be 9:30 a.m. Central Time. That will be cancer prevention in our hands and not our genes. So for those of you who are interested or who have friends that you think might benefit from listening to today's webinar or future webinars, please know that they are all archived on our Terry Talks Nutrition YouTube website. So if you go to YouTube and type in Terry Talks Nutrition, we have a channel where we have recordings of all of our past seminars. We also have recordings of our past seminars on terrytalksnutrition.com, which is an information site about integrative medicine and natural products. You can go there and sign up for a free weekly newsletter for the latest news in natural therapies and sometimes some motivational advice as well. And you can also directly ask Terry Lemerond on the Terry Talks Nutrition website if you have burning questions for Terry on health or wellness or even on the natural products industry. For your daily dose of natural medicines, you can follow Terry on Twitter at twitter.com/Terry Lemerond, and we'd also be honored if you'd find us on Facebook. We also have a Facebook page called Terry Talks Nutrition. Well, thank you, all of you, for joining us today to learn more about natural therapies to help individuals with anxiety. We hope this has been beneficial for you, and I hope that you'll join us again for an upcoming educational presentation. So until we meet again, good health to you. Bye-bye.